Hi everyone, welcome back to Nurse Katherine here. I'm so happy you are here because today we are going over a topic / I'm teaching you something that is so important to remember, especially when you are a practicing nurse. In today's video, I am going to be going over 11 directional terms that are a must know for when you are a registered nurse. Before I get this video started, don't forget to hit that subscribe button and give this video a big thumbs up to help get this video out to other students or nurses just like you. To help you understand these directional terms, I'm going to be showing you a picture of a body, and you can follow along with that as I point out what the directional terms are. So let's get this video started. Alright everyone, so here we have our skeleton that I will be using to show you these directional terms today. So we are going to go through this entire list right here, and these are all the directional terms that you will be hearing in the hospital. So the first one is anterior, and anterior means at or near the front of the body. So that is this portion of the body. Now we are going to go on to posterior, and that is just the opposite of anterior. So that is at or near the back of the body. So that would be this portion right here. Next is midline, and for this one you just think about drawing a line down the center of the body. This divides the body into right and left sides. Next, let's go on to lateral. So lateral means farther from midline. When thinking about lateral view, this would be this portion. So it's farther from the midline. This is your midline right here, this line that goes up and down. Further from that would be towards the outside of the body over here, which medial is opposite of that. So medial, you have your midline, just think of middle. Medial is middle, that is closer to the midline of the body. So medial means nearer to midline. Okay, so now we are going on to our superior term. Superior means toward the head of the body. So for superior, just think that somebody is superior than somebody else, and that would be at the top of the body. So superior is higher, inferior is opposite of superior. Inferior means away from the head, and it's the lower part of the body or structure. Inferior would be down here. This would be the lower part of the body. Superior is the upper part. Inferior is the lower part of the body. Next, we go into superficial, and superficial means close to the surface of the body. So that would be your skin surface. Think that is very superficial, like you have a superficial scrape. That's a good way to remember it, because opposite of that is deep, and that means away from the surface of the body. That one is pretty self-explanatory between superficial and deep. Deep meaning away from the surface, so deeper into the body. Superficial meaning close to the surface of the body. Okay, this next one is proximal. Now proximal means nearer to the structure. So that means that your proximal, that would be this portion. So this is the closest part of the arm to the body. Opposite of that would be distal. Distal and proximal are opposites of each other. Distal means the furthest point away from the actual structure of the body, and proximal means the closest part to the structure of the body. So this would be the proximal portion of the arm, your hand would be the distal portion of the arm. So let's do another example. Let's use the knee and let's use the foot. Your knee is closer to the actual structure of the body. Your foot is further away or distal to the structure of your body. So again, distal means farther from the structure. And our last two are very simple, right and left. You have the right side of the body, and remember that is an anatomical position, and you have the left side of the body. And that is when you use that midline to divide it into right and left.
All right, and that is it for today's video, guys. Thank you for watching and thank you for tuning in. I hope you learned something from this video. If you did, don't forget to share it with other students or other nurses so they also can learn this information. All right, have a great day and I will see you in the next video.